Good morning, folks. We're just going to have some let participants join in. We've just started broadcasting and it is recording, but we'll get started in recognizing we're a bit over 10:30 start. We'll get started very shortly. Okay, so good morning. Welcome to my home office. My name is Amber Crawford. I'm a policy advisor with the Association of Municipalities of Ontario. And today we're joined by my colleagues, Michael Jasek, who is a senior advisor for Health and Human Services, and Monica Turner, who is the director of policy for all of AMO. We are also joined by a series of panelists who are not on video, but are online listening to the first session and are really pleased to have them with us here today. I know it's an incredibly busy time for everyone, with it being budget day. This was scheduled previous to budget, but anyways, I'm really happy that everyone can be here and appreciate you taking the time with us this morning. Before we get into some of the content, I wanted to take you through some housekeeping issues. So due to the number of registrants, we have decided to run this as a webinar as opposed to a meeting, and that basically means that you're not able to sort of unmute your line, but there are ways to participate. For technical issues, if for whatever reason something glitches, either on our end or what have you, we've got Michael and Monica who can jump in if the slides sort of disappear. Other technical issues, if you can't hear anymore, use the chat function to do that, and myself and our colleague Ian can help you on that side. And for questions to the panelists, we're asking you to use the question and answer function. I will provide a bit more definition or sort of rules around those questions, but in the initial session, if you have questions of clarification or what have you, also put those in, and then the question and answer session will begin at around 11, and we'll get to those questions in sort of the order that they come. As I say, we're pleased to have sort of AMO staff to answer AMO related questions, but as well as our panelists to provide their unique perspectives as well. The slides are going to be circulated to all of the participants, and as I say, the presentation is being recorded. So if you have elected officials or staff that haven't been able to join today, it will be posted and sent out to you to share with your colleagues. So with that, the agenda has a series of sessions, and we're really pleased to have sort of an overview to start the position on what our advocacy has been on long-term care and seniors. Obviously, with COVID, it has been quite a year. And for those that own or operate long-term care homes, there's, I know, over 100 municipal long-term care homes. It's really been important. And so what we wanted to do is give you a sense of what the AMO board has directed us as staff to do, and also how we've participated and submitted comments to the submission or the commission rather, both in the interim in October and then our final submission that we put forward in January. And then of course, we're going to shift to the panel introduction. I'm going to reduce the slides and we're just going to open up to a question and answer session. So you'll have the opportunity to ask sort of either what the spirit or intent was of some of these recommendations, or your thoughts on whether or not or input into sort of what the staffing plan looks like generally, because we know the Ministry of Long-Term Care has released something which is separate from this independent commission. And then we'll end at around sort of certainly before lunch, but we'll end with maybe some website resources and a wrap up. So with that, I will pass it over to Monica, who is the director and also the chair of the Long-Term Care Working Group, to take us through an overview.
Thanks, Amber. As everyone knows, Ontario's municipal governments work together to achieve shared goals and meet common challenges through AMO. One such cause is promoting healthy, age-friendly communities, which includes municipal long-term care homes, operating in an effective, efficient, and safe manner. Please know, and it's all on our website, we've put out at least 3 papers in the on this issue of long-term care and seniors in our communities, 3 papers in the last 10 years. So we're not new to this issue, and we've got all the historical background if you want. As we all know, and we've all experienced, COVID has been challenging for long-term care. From our perspective, the pandemic has exposed the structural weaknesses in the system, especially the chronic underfunding, which has limited the ability to respond effectively in the first and second waves. Again, all documented, long-standing advocacy issues, but unfortunately, COVID really has shown us those issues. We do acknowledge the provincial response to date and the support that has been provided, and we have thanked the province for that. However, more action is needed in both the short term to continue to mitigate against the waves of COVID as we're coming into the third, and over the long term to address persistent structural issues. Our seniors and long-term care residents deserve high quality care, the utmost safety, both during the pandemic and beyond. So with regards to the municipal role in healthcare, again, we've written many papers, they're on our website, is one general comment, and the commission has acknowledged it, and so have many journalists, is that the data and the analysis demonstrates that municipal homes, long-term care homes, have fared well comparatively during the pandemic. We believe this is due to the commitment and investment that municipal governments make to long-term care over and above the provincial funding. In 2016, it was estimated that municipal governments contributed $350 million over and above the provincial funding subsidy, which does not include capital expenditures. Overall, municipal governments invest over $2 billion in senior programs and other health services on an annual basis. This funding has an impact in communities. It's enabled municipal homes to be leaders in the field. However, it should be noted, this is not sustainable. Municipal governments cannot continue to fill in the gaps where provincial funding is lacking. It's healthcare, which is a constitutional area of provincial responsibility and jurisdiction. The municipal property tax base was never designed to pay for healthcare, but it does. Many municipal governments and their residents wish to see more municipal long-term care homes built or expanded, but it's not affordable to do so at this time. This is why AMO continues to advocate strongly about long-term care on behalf of our members and our residents. I'll now turn it over to Michael Jasek.
Thank you, Monica. To provide some context, I'm going to start by highlighting a few facts and figures that are up on your screen. First of all, there are over 600 homes in the province, to give you an idea of the magnitude of the delivery. About 16% of these are municipally operated and co-funded, a quarter are nonprofit, and the majority, or 59%, are private. Funding all the homes collectively accounts for about 7% of the provincial healthcare budget. And while the provincial government is responsible for legislation, regulation, and program requirements, upper and single-tier municipal governments in Southern Ontario are mandated under the Long-Term Care Home Act to operate a home. And in Northern Ontario, municipalities may operate homes voluntarily, but if they do, they are subject to the Act and the regulations. The demand for the new beds is evident from large waiting lists. To meet this need, the Ontario government has committed to build 30,000 new beds within the decade, and about 80 projects were announced last week to get this going. It's still an open question whether this will be enough capacity to meet the demand, and other measures the government is doing is piloting community paramedicine in a few communities to help people on waiting lists to live at home until they can be admitted to a long-term care home. So now moving on to municipal sector advocacy. It's well known that the municipal sector is at the forefront of developing age-friendly communities and providing vital services to seniors. These include things, of course, like long-term care, affordable housing, public health services, and other community support services, among others, like recreation. Given the municipal role in health and its interest in age-friendly communities, AMO is a strong advocate when it comes to long-term care. And over the years, we have developed and released several position papers with the aid of specialized task force and working groups. The underlying premise in all these papers is that with the mandated role and the significant investments being made, the AMO municipalities need pay for say and a well-considered voice when it comes to long-term care. And the recommendations in these papers have all focused on improving resident quality of life and protecting municipalities from rising costs. Next, we'll talk about AMO's participation in the Provincial Long-Term Care COVID-19 Commission. So AMO looked at the opportunity to respond to the independent commission set up by the government, and it has a mandate to investigate why COVID-19 spread in long-term care homes, what was done to prevent the spread, and the impact of key elements of the existing system on the spread. And it was good to know that the commissioners have broad scope and latitude to consider almost any area that they deem necessary to fulfill their mandate. 2 interim reports were issued, and the final report is expected by the end of April. We hope that the recommendations will be a watershed moment and propose solutions that can act against similar pandemics and disease spread in the future. To do this, it'll be necessary to fix the long-term care system in a big way. And simply put, we feel that it needs to be rethought and reimagined. In order to respond to the Commission, AMO set up a specialized working group that advised our Health Task Force and ultimately our board. 2 submissions were developed and made along with testimony to the Commission. And in our final submission, recommendations were made across 9 thematic areas. And the report was circulated to all of you prior to the seminar, and it is posted on the website for the public. Now, Amber Crawford, AMO Policy Advisor, will walk through the categories at a high level. Over to you, Amber.
Thank you, Michael. And I wanted to start with just letting, I think what Michael said is perfect in terms of the interim report versus sort of the final report. There were a couple things that I wanted to say on the categories. Our interim report, as Michael said, tried to get us through winter 2020 and 2021. And so we ended up having 6 categories, and we've added 3. As you'll see in the next slides as I go through, one was the vision for long-term care and leadership culture. We also added inspections for enforcement and compliance and for palliative care delivery. And so those were ones to flag in terms of the evolution of these comments. As I do go through these next 4 slides in charts, just to make it clear that I'm speaking on behalf of the working group. So when I say the group thought that or expressed that, that is the voice of which I'm using. And of course, those were then endorsed by the AMO's Health Task Force and then by the Board of Directors, who ultimately put forward these reports. So what we wanted to do in this section was to share with you the spirit and intent of these recommendations. And so what I wanted to do was start with leadership. And of course, I'm not going to go through it in any particular detail, but give you a flavor of sort of what each of them thought. The group felt that the culture and leadership required in long-term care is fundamentally different than a hospital's institutional or acute healthcare mindset, and that the long-term care is a home where residents need to feel supported, live with dignity, and have their care needs met. The sector thought that it should welcome leaders into the sector and promote leadership from within at all levels of the organization. And it was expressed in the staffing plan, one of the pillars to provide an effective and accountable leadership. And the group felt that while important, so was supporting those that are already in it. And we can speak to, the panelists certainly better than us, can speak to the burnout and other experiences that they've sought. But the group felt that, not only is it important to empower, support, and strong leadership is critical, making sure that those that are already in those positions are supported. Regarding public health and safety, the group felt that COVID-19 obviously showed the necessity for specialized expertise, and that's infection prevention and control, or IPAC. And so those are the recommendations you'll see before you that we made to the Commission. We also outlined some lessons learned in this section, including the need for testing, vaccinating on site, and maintaining a strong PPE inventory, and that funding was important to recognize these to help homes control and, if possible, avoid outbreaks in the first place. The third theme was funding, and we all know it's been chronically underfunded. Hopefully with the budget today, we'll see more information come out, but we do know that changing the funding allocation model is important. The staffing plan that we can speak to, this is the one that was released by the Ministry of Long-Term Care in December, speaks to some of these. And so it is important to make sure that these are differentiated between the independent commission and the staffing plan that you've seen. So there are in some cases overlays, and we'll speak to those as well. But at the time of writing in January, we had said that funding was very important. And in particular, we mentioned the High Wage Transition Fund, which is set to end or sunset at the end of March of this month. of this year rather. But as a principle, we've suggested that there is no time to reduce funding to the sector, particularly now. And other amendments talked about the redevelopment and focusing on those 3 to 4 bed wards that were particularly problematic in these sorts of IPAC related issues. And so that's why funding is sort of, it's its own bucket, but also it weaves in throughout the others. In terms of planning and communications, we talked about having input from the sector was needed earlier. And initially that homes felt that decisions and guidance were not clear or consistent. That did not only apply to the province, who we understand have put out over 400 directives during COVID at this point, but also with public health as well. So we talked about the lack of lead time that some homes got between the directives that came out potentially on a Friday or a Saturday for implementation on that Saturday or Monday. And that we also looked forward to being relied on more in terms of their expertise from the long-term care sector and focusing on long-term care at the same time as hospitals if there is another outbreak in the future. Staffing measures, there were 7 recommendations for those, and we talked about the group felt that supporting staff redeployment was essential and critical for long-term care through the first and second wave, and obviously into the third. They did talk about the pandemic pay as a subset of workers and the need to recognize the wage compression issues and morale that came with those. The need to be involved in the working group around full-time employment. And I know that Advantage Ontario is here today for the first half hour of our panel, and they're involved in that working group, which is great. But we also talked about the need to recognize the invaluable roles outside of the regular workloads. So people like housekeepers, activity staff, cooks, etc. People thought that those roles of things that make homes a home was really critical and needed to be supported. Moving to caring for residents, there were 8 recommendations made in this area by the group. We did support the move to 4 hours of care, average daily, and we're happy to see it in the staffing plan that came out. The caveats, of course, are that must be funded and that the homes that are already in those incremental steps should not be penalized, or the corollary that more money be focused on those homes that aren't at that level. We talked about homes with residents of higher acuity needs or dementia fared harder to manage, so dedicated funding for training for emotionally focused and patient-centered care during the outbreak and beyond was really important. Inspections, as I mentioned, was the second category that was added from our initial in October, and the idea for that was twofold: both the compliance and enforcement pieces. The group recognized the need to ensure safety for all residents, but after much deliberation, the group thought that a risk-based approach versus a punitive one was really what we needed. And the panelists will have more case studies and again experience on this, but felt that more of a focus on coaching for compliance, best management practices, either through the Center for Excellence, which is being put forward as a proposal and that we echoed in our pre-budget submission, was important, particularly during COVID when there were already a lot of pressures on the system to begin with. The last 2 is mental health and well-being. Obviously, we spoke at the time of writing about 40% of long-term care homes had been an outbreak or were, putting a massive strain on workers that were already there, both leadership and on the ground. And so the need for mental health specialists and to alleviate current staffing shortages would help in the meantime. And that we also, the group discussed the social isolation and the need for virtual technologies with adequate broadband access to make sure that folks could keep in touch during this during the lockdown periods and even into today. Finally, the group felt that palliative care delivery was essential and end-of-life care for residents was critical, and to adopt a philosophy of care around palliative approach and delivery was important. There was more to be done in terms of formalizing and integrating palliative care approaches into long-term care homes. And while the Act does require training on it, the group felt that money and other supports from the province were key to implement that. So at that point, that was a lot of information. What I am going to do now is invite folks to our panel. I believe, I'm not sure if we've got everyone on, but if those that are the pictures on the slide, if you could sort of join us. And what I would like to do is to provide, as you're doing that, attendees with a bit of what we're going to do with this section. So the point today is to thank you. And I know Michael will do that in his wrap up as well. But on behalf of AMO, thank you to our panelists today, of all days on budget day, for being here and providing your insights. They've been invaluable to us. As I say, as AMO staff, Michael and I and Monica certainly rely on your expertise, not only on the ground, trying to keep your home safe and all of the homes safe that you represent, Lisa, and certainly appreciate it today. What we're asking for today is if you have questions for the panelists, you can either direct them specifically to them, or you can just sort of put it out there and we'll triage appropriately. And as I say, we've got Monica and Michael here as well. If there's AMO specific or broader questions that the panelists can't speak to, we're happy to jump in on that as well. But I think what I'd like to start off with is maybe a roundtable for each of the panelists to sort of introduce yourselves, maybe take 3 to 5 minutes to sort of let folks know who you are, what your role is. If you do have municipal homes, maybe a sense of the size of them, and then we'll go from there. But Kathy, I think I will start with you, and I will stop share this screen.
Thanks, Amber. Can you hear me?
I can. Thank you.
Okay. Good morning, everyone. So as Amber mentioned, my name is Kathy Granger, and I'm the Director of Long-Term Care here at the Region of Peel. Currently, I am redeployed, like so many others, to support our public health COVID response. But in my regular day job, I am the Director of Long-Term Care. We have 5 homes at the Region of Peel for a total of just over 700 people living in our homes. We also benefit from having an adult day center in each of our homes, which we're quite happy for. I guess like us, running municipal homes, like many of our partners who are on this call, we were passionate and committed to enhancing emotional care and clinical care well before the pandemic began, and with lots of support from Advantage Ontario. So look forward to talking further about that today.
Thank you. Lisa, would you like to introduce yourself and Advantage Ontario more generally as well?
Sure. Thanks so much, Amber. So I'm the CEO of Advantage Ontario. We are 101 years old, and we're the association that represents not-for-profit and municipal providers of seniors housing services, including long-term care, supportive housing, assisted living, life lease housing, social housing, etc. 200 of our members provide long-term care, and we have most of the municipalities across Ontario that provide long-term care are in our membership. So we do advocacy for the sector, and we also provide a lot of education and training, including the Administrator Leadership Program. And during COVID, I redeployed the entire office pretty much into COVID response, ranging from finding PPE for members in the early days where we couldn't find any, to helping homes get staff when they were having staffing crises. And we also, I would say, we're curators of information. In wave 1, we had daily webinars, and now we're doing weekly webinars and many, many bulletins and emails.
Thank you. I will pass it over to Kelly to introduce himself.
Thank you, Amber, and thanks for the picture of my younger brother on the intro there. It's much appreciated. My name's Kelly Pender. I'm the Chief Administrative Officer for the County of Frontenac for about 7 years now, coming up in another week or two. We operate one long-term care facility in rural Kingston, technically Glen Burnie, Ontario. 128 beds that we manage. We have about 200 staff. I'm also part of the Eastern Ontario Wardens Caucus, and the Wardens Caucus is the 13 upper tier and single tier municipalities, 2 single tier municipalities in Eastern Ontario. And earlier this year, we commissioned a study, an external review of our 15 homes, and KPMG completed that study. There's links on the Eastern Ontario Wardens Caucus website if you're interested. But we certainly believe in partnerships, and our partnership with AMO, Advantage Ontario, and the Eastern Ontario Wardens Caucus is critical. And we believe in having good information when we go to the province. So we completed the study. There's 6 recommendations, which largely follow the themes in the AMO report. At Fairmount, our long-term care administrators Lisa Hervey and now Susan Brandt have been excellent advocates for 4 hours of care. The County of Frontenac began our journey to 4 hours of care in 2018. So we were a bit ahead of the curve, but we have a very progressive council that saw that as a priority, and we've been implementing that. And we look forward to the province's continued support for 4 hours of care. And just a reminder that 4 hours of care is a 2008 Sharkey report recommendation. And at that point, the average length of stay in long-term care in Eastern Ontario was about 5 years, and now it's under 2 years. So I think, it's an admirable goal, but I'm not sure it's the end point. But we certainly support the move towards 4 hours of care. So thank you and welcome everybody this morning. Thank you.
Thank you, Kelly. And last but certainly not least, I'd like to introduce Jane Sinclair.
Thanks very much, Amber. Good morning, everyone. I'm General Manager of Health and Emergency Services for the County of Simcoe. We have 4 long-term care homes. 3 of them are situated on campus type settings. We have 544 long-term care beds. And I'm really pleased to say that we were just approved for 34 new beds to our oldest long-term care home in Beaton, and we'll be moving forward with the significant redevelopment to expand that home to 160 beds and build a large seniors campus with 9 different types of housing, similar to our most recent model in Georgian. So currently we serve about 1,300 seniors across our 4 locations with various types of housing and services and partnerships. As per Kelly's comments, we're real huge believers in partners and really look forward to working with others. And I'm also the board chair for Advantage Ontario. So I do have a bit of a bias, obviously, in that position, but I can tell you it's been a real privilege to work as chair, even though extremely busy during the pandemic. But certainly Lisa's comments, the daily webinars and pushing out clarification on the information regularly has been, like a life preserver, a lifesaver for us through this past year. So I'll stop there and very pleased to be here. Lots of learning through the pandemic, that's for sure.
Yes, and thankfully for those of you on the ground have been really helpful with Michael and myself and Monica, obviously through your experience. And I remember speaking with you folks back in March saying, what a busy time. And I don't think I've ever stopped saying that every time I speak with you. So I think what I'll do is, and I do, welcome comments and questions from the sector, but I think to start off the conversation, I wondered if anyone wanted to jump in and sort of say, based on your knowledge and expertise about long-term care, what key themes that we as a group and AMO board provided to the commission most resonated with you and why? Go ahead, Kathy.
Just take myself off mute. So yeah, and we really did enjoy this opportunity to be able to participate and hopefully have our recommendations heard. It was a great opportunity. So thanks to all at AMO. Yeah, I think the one that I continue to feel most strongly about, and certainly was brought home during the pandemic, is just our overall vision for long-term care. Our belief that it is a home and not just a hospital. And this was reaffirmed when we had hospital employees, although they were meant to be really helpful coming in to support the pandemic. Certainly their how they provide IPAC is quite different than our needs in the homes. So I think we continue to move forward, particularly in municipal homes, with the idea of creating a home, valuing people's emotional care as much as their clinical care, continuing to provide extra supports that we provide in municipal homes, which made a huge difference during the pandemic. The municipalities, as Kelly said, and our council have been extremely generous to provide us with extra supports to focus on this. But despite all that, it was a big challenge. But I think that's why you saw the outcomes of us during the pandemic better than other homes. So I think it's quite important that we remember that as we think about where we want long-term care to go in the future. Thank
Hi,
you.
Amber. Maybe I can comment really quickly as well. Two things right out of the gate really resonated for us. And one is about our vision and culture, culture in particular. Going through various outbreaks and partnerships with various hospitals and other partners, family health teams, et cetera, working with public health. One thing that we really identified very strongly is there's a very distinct culture in long-term care. And many of the learnings around IPAC implementation, preventative processes and procedures are not easily transferable from one type of healthcare setting to another. So using acute care as an example, the culture in acute care is very, very different than the long-term care sector. And I think some of our challenges, even going forward, will be to find that balance between ensuring we have the best preventative measures in place for infection control and prevention, but still respecting the culture that we've worked for decades to preserve about creating this home-like environment for our residents. So that has been a real challenge for us to really find that sweet spot between the two. And then the mental health and wellness, both from the resident perspective and from the staff perspective. COVID-19 has flipped us on our heads in terms of our delivery of service and residents not having that same contact and programming, often in isolation because of preventative measures, et cetera, and just the ongoing pressure on our staff, just managing day to day under these provisions. Mental health and wellness is a really, really critical component. And I think we've had lots of learnings and opportunities to really build on our processes to support those particular needs. So a couple of observations.
I can go next. So, well, Kathy and Jane, you took away my points, but I think that really to wrap it all together, I would say looking at the last year, it was a combination of homes basically being under assault from an invisible enemy, not having the staffing and the funding and the knowledge of IPAC to be able to deal with it, and the resultant mental health impacts on the residents and on the staff. We need to now heal the sector. I mean, not that we're through this pandemic yet, but I'm hoping to goodness that we are, we've seen a major reduction in outbreaks in homes because of the vaccinations, thank goodness. But we need to look at moving forward. How do we heal the sector? There's a lot of PTSD and there's not enough staff. People were burnt out before COVID. So we need to find ways to move forward and learn from this and come out better and come out ahead and see what can be done to improve the sector on a go forward basis.
And I think the real, we've done a lot of learning over the last year, but I think we're going to do a whole lot more learning over the next couple of years as we implement this. I mean, the simple fact that PSWs, after they graduate, only last 2 years in the sector is troubling. We've said that they can't work in two homes, but I mean, that doesn't negate the fact that they need two incomes to survive. So instead of working at Fairmount and Rideau Crest, they're now working at Fairmount and the Metro store. I'm not sure that that's a success story. And I fully recognize that not everybody wants to work full-time, but we've got a whole lot of learning to do over the next couple of years as we implement, the 4 hours of care model and where that's going to go. And, we're only going to be as good as our staff. And as everybody said, that's where it starts and that's where it's going to end. So need to stay focused on that.
Thank you. That was great. I think that segues really nicely into the sort of 4 hours of average daily care. I think our first category that we were talking about is sort of the ministry staffing plan, and of course the upcoming budget today. So I think first, if I could ask Lisa to sort of, in your own words, sort of try to help just differentiate between the staffing plan that the ministry put out and this independent commission, and then I'll ask Monica to provide some comments about whether what AMO is doing to submit comments on the plan.
Sure, and I do have to apologize that I can't stay on for the whole thing, but I have a pre-budget pre-budget in the most imminent sense meeting with Treasury Board and Ministry of Finance and Long-Term Care at 11:30. So the staffing strategy is a very interesting document, and if you haven't had a chance to look at it yet, I strongly recommend you do, because it is more than a staffing study. I see it as actually a strategic plan for the long-term care system that has 4 pillars in it, in addition to the recommendations and areas for staffing. So the 4 pillars are integration of long-term care within the broader continuum, quality of care, performance oversight and accountability, and physical infrastructure. That is more than a staffing plan, which is good. I don't know why it was positioned this way, but it is an interesting read. And it goes so far as to talk about changing CMI and the funding formula. And basically, I think they're going to reopen the Long-Term Care Homes Act because it talks about reduction of red tape and streamlining documentation from a staffing perspective. And so in the staffing study or staffing report, which comes from the staffing study, there are 6 key areas of action: increasing staffing levels, disrupting, accelerating, and increasing education and training pathways, supporting ongoing staff development, improving working conditions, providing effective and accountable leadership, and then measuring it all. And so this is exactly what we have been looking for, which is a comprehensive health human resources strategy. We know we cannot address these systemic and longstanding issues in the system with just one measure alone. If you just provide more education and free education, then people will leave. If you just provide more staff, who's going to come into the jobs because they won't get paid for on-the-job training? Like, you need to have that comprehensive perspective, which this provides. And then the commission was basically put in place to look at what happened during COVID. And it's been an interesting type of commission because the pandemic has been ongoing. So it's not like the Wetloff inquiry where the murders were committed and then the inquiry happened after the murders. This was a commission going on during the pandemic. So as a result, they released interim recommendations, which we have seen, and we know at the end of April, they'll be releasing their final recommendations. And so there is some overlap between the two because a lot of the issues that arose during COVID and long-term care related to inadequate staffing, inadequate funding of staffing, the fact that so many staff do not work full-time in long-term care. And so those have all had an impact and exacerbated the effect of the pandemic on the homes.
Thank you. Thank you for that. And Monica, I think I'll pass it to you to sort of let folks know on from AMO's perspective what we're doing about that staffing plan.
Fair enough, and thanks, Amber. It's always fun to go after Lisa because she always gives it such a comprehensive. No, this is good. You're the expert. I'm just learning, catching up. But I just to let folks know, AMO board is meeting later this week, which would be Friday, seeing we're in Wednesday. And we are taking the recommendations we put to the commission. There's 15 of them, and putting them into the board for our more focused response on the staffing plan. So again, you'll be seeing AMO talking about this at the same time, working with all our members and with Advantage.
Thank you. And I think for time purposes, I want to get Lisa's second question in that I've put forward to her to speak about the pre-budget submission that Advantage Ontario has put forward, given that whatever happens today, we're not sure, but from both Advantage and AMO's perspective, what we've been asking for.
So we made 12 recommendations. The first is that there be additional money for IPAC so that each home can have their own dedicated IPAC person, because while some money was given for IPAC, human resources, it wasn't enough for homes to have adequate resources. We've also asked that that the wages of all staff in long-term care be increased to ensure parity with the acute care sector. This is less relevant in the municipal sector because you're already doing it. However, you should be reimbursed if this in fact does move forward, although I don't see it happening. It was sort of an aspirational ask. Sometimes we put forward things to push the yardsticks, but don't necessarily expect it will happen in full. We then asked, we commented on the staffing strategy and we said it's amazing, but there's one of the major gaps is that we need to have a specific strategy for rural, remote, and northern areas of the province who are in crisis before COVID. And it's not enough to just do the same for them as everyone else. We need very specific strategies for them. We wanted to hold the government to the 4 hours of funding commitment because they hadn't provided, or 4 hours of care, because they hadn't provided the actual amounts of money there that will be given out. And we're hoping today we will hear that. And we asked that the province double the funding for the minor capital program. And we know that some funding announcement did come out a couple of days ago about minor capital. They did not double the funding, and they're basically saying you better spend it on air conditioning if you don't already have air conditioning. We asked that, this is where we go beyond our long-term care part, that the province work with the federal government and municipalities to increase the supply of affordable, appropriate, and accessible housing for seniors, including supporting funding for emotional-based models of care across the seniors care continuum. We said that there needs to be a significant investment in assisted living and supportive housing, because that is the missing middle that we have in Ontario. We have long-term care and we have home care, although not enough home care for sure, but we need to have options for people who can't afford retirement housing. I don't think we're going to see that today, but the province is starting to wake up to this concept, and I'm hoping in the future we might hear something. We made a very aspirational ask that all new long-term care beds only go to municipal and not-for-profit homes. And we did see in the announcement last week that more beds did go to not-for-profit and municipal, as did the announcement a few months ago, which is the first time that has happened in years. So it's not exactly what we want, but we also didn't expect to get exactly what we wanted. And we are actually going to be meeting with the ministry this week to propose a second stream of funding to enable capital development and redevelopment in the not-for-profit and municipal sector. We want 4.4% increase in level of care funding. There was only 1.5% increase last year, which was inadequate. And we want to make sure that all of the expenses that you paid towards COVID get reimbursed. And I know that Homes moved forward and gave the government information on your expenses, and we're hoping that things will be reimbursed completely. We asked for a federal backstop on insurance. And we also asked that the province invest $11.7 million to establish an Ontario Centre of Excellence for not-for-profit long-term care and municipal long-term care, which is a pretty big ask. And we'll see what happens, but I'm not feeling it. No one's called me to say that they have this money available, and am I ready to do a press release? So, but I also don't think it's necessarily not happening.
That's great. That's great. And I think, as you know, I'll preempt Monica just to say, you know, AMO's pre-budget submission has to take all of the divisions. So you won't necessarily hear as many from our side of things. But if Monica, you can provide even an overview of sort of what we had been asking for in our.
Yep. And Amber, that's exactly it. The joy of AMO representing the municipal sector is the municipal sector does everything, I would say. And so we very much focused on COVID, being hopeful on the recovery, looking at hard and soft infrastructure in an integrated way. And I just want to point out that, yes, we're always looking for funding for infrastructure, but we are very much talking about broadband, childcare, long-term care, as if you want softer infrastructure. It's not all about roads and bridges and such. And that used to be the way to recover out of a recession, not the way you need to do it now. So that's the broader concept. Yes, there's a section in there. And by the way, this is on our website. We did have a section about long-term care where we did also talk about infection prevention and control. Again, more money is needed. We also highlighted, and I'm sure people on the call know this, the high wage transition fund is supposed to end in about a week. We need that. We need to continue that. And we have been advocating for that both in our pre-budget submission and every other opportunity we've had. And I'll tip my hat to Michael on that one. He finds a way to put it into virtually everything we do. And as well, we've asked for a clear provincial plan about long-term care bed expansion for all of the province, because again, 444 municipalities, we are looking at urban, small urban, rural, northern. People want to age in place. Where's the long-term plan for all of that, as opposed to just, and forgive me, the growth areas? People don't want to move if they've been living rural or small urban, don't want to move into an urban place. They want to stay again, where home is. And so we want to make sure that there's a good provincial plan for that. So those are my comments. Amber, back to you.
Thank you. And I wondered actually if the panelists had, that brings up a really good point. I know Lisa brought up the continuum of care and affordable housing. Michael, did you want to speak to the affordable housing pieces that you've been working on and the broader health and human services work that you do at AMO?
Sure. Yeah, well, we, as Monica mentioned, municipal governments do everything, and provision of affordable housing and other human services is a key piece that we continue to advocate on in the pre-budget and other forms. Lisa mentioned about the need for more assisted living for seniors. We do hear from our members a lot about the need for housing for seniors in communities, and to Monica's point, in the communities where they live, not communities that they have to live to. So in the pre-budget submission, we talked about the need for more funding for housing. There is some capital money that's been available from the provincial and federal governments on housing, but we're lacking some operational funding to provide the supports that people need to maintain their successful tenancies, including seniors. So yeah, and I would say that we weave in seniors' interests in a broad range of policy advocacy that we do, whether it be about promoting planning for age-friendly communities, meeting the World Health Organization designation, whether it be in public health or community paramedicine or other services along those lines. So so it is a top of mind consideration for AMO.
That's great. And thank you. I think I'm going to flip it actually to Jane, because I think I want to get into this innovative models of care, because that builds off of Michael's point of sort of the looking outside the box we talk about. And I think, if you could speak to, with that exciting announcement, congratulations, what type of innovative care models have you been looking at implementing, and how can participants here learn more, whether or not it's on your website or what have you?
Thanks very much, Amber. And it is very exciting news. So really what we've looked at the last number of years is expanding in terms of campus continuums. So building not just long-term care, but combining with other types of seniors housing. And we've seen some huge benefits, both in terms of access to services. When you co-locate various types of housing along with your long-term care home, you can really optimize and more efficiently offer some of the services than if they were standalone programs, housing programs. So we've seen some real synergies, and even our reflection through this pandemic and IPAC and you know, all the changes and precautions, et cetera. Again, we're able to, I think, leverage those learnings from, you know, from long-term care experience specifically, and rework some of those learnings in terms of protecting and supporting seniors living on a broader campus. So it's been a great experience, and you're able to build in other types of housing, affordable housing, you know, assisted living, supportive housing, et cetera, as well along the continuum. And from a financial, and we heard at the outset of the presentation today, municipalities invest so much money into long-term care and into housing and senior services, et cetera. And, you know, our experience in looking at innovation in co-locating various types of housing and services, it's financially sustainable. That's a big piece of it. So our largest operation in Penetanguishene, the campus itself generates revenue annually. We're not for profit, obviously, but we're able to take those additional revenue streams and reinvest them to offset the loss in long-term care. That's a story in and of itself, but to also you know, help sustain the capital infrastructure and build programs. So with our recent announcement, it's going to be a significant investment in capital, but again, we will be able to really provide extended services to support that whole continuum of seniors and do it in an affordable fashion that's not a burden on the tax base. So I think there's some pretty exciting opportunities.
That's great. And thanks, Jane. And I'll pass it to Kathy, because I know you also have an innovative model around dementia and the butterfly model. Could you speak to that?
Yeah, I'm happy to speak about the butterfly model, but first I just want to give a shout out to Jane, because we at the region are going to open our first campus of care, Seniors Health and Wellness Village, and we certainly had some inspiration from Jane. We've been down to see some of her homes, so we're excited to open that hopefully later this year. We have had some pauses because of COVID, so we're excited for that. But yeah, we, as I mentioned, have been focused on enhancing emotional care. We did undertake a model in 2017, and we used the butterfly model of care, and it was in the media and stuff. We chose that model because it really had a good change management piece of it, and a really good sustainability model. And it really does put the emotional well-being and the person living in the home, and also staff well-being, at the center of its model. And we've had really good success with the model. It is really intensive in terms of training, and we did bring on extra staff. The municipality or our region was really supportive in bringing on extra staff. We train all staff, and we really do believe that in our long-term care homes. We train all our housekeepers, maintenance staff, dietary staff, all in emotional care. So it really is a full family supporting the people living in the care. And we've had great outcomes in terms of you know, resident clinical outcomes, like decreasing antipsychotic use, decreasing falls, but also enhancing staff well-being indicators, decreasing absenteeism. And we have had hundreds of people through the home to see. Now we've expanded it into our third home, and we're happy to provide further information about if anybody's interested in coming. It is intensive. It does take about a year to implement successfully, and there's always ups and downs because of staff retention issues, which everybody faces. But yeah, happy to, it is on our website, and happy to provide further information.
Excellent. And maybe I can, as I round out, send the slides out, maybe I can include some of these links too. So everyone will have to, they'll be able to all go to one place. But Lisa, with 3 minutes left, I wanted to give you just one last thing. And then Kelly, I want to ask you about money. So get ready, get ready as the funder. but Lisa, is there things that parting words you want to leave with us today?
Thanks, Akshay. Thanks for giving me that opportunity, because I was thinking, oh goodness, there was something else I wanted to say. And that is that I'm so proud of all of the municipal homes. You have done an amazing, amazing job through this pandemic, and the municipal difference has really shown. The fact that, you know, you already provide, have more staff, have more resources, and all of the infrastructure that you have supporting your municipalities. It has just made a massive difference. And, you know, many of the leaders in this pandemic have been the municipal sector. And I know that you're probably very weary and very tired and very exhausted, but you have done a fantastic job. So I think you should all applaud yourselves. And that is really all I have to say.
That's great. And thank you again for providing your time out. We'll let you go and good luck and with all the other meetings.
Gonna go try and get some money from the government. Talk to you later.
See ya. So Kelly, speaking about money, I would like to, I have a couple questions and these are about sort of the municipal councils as leaders and funders. And so, you know, my first question to you is sort of as we strive towards vaccinating seniors in our communities, as a rule, as a CAO, sort of what have you been doing and what have sort of even the Warden's Caucus been doing to help prepare those councils both in the budget cycle and other ways to make sure that our seniors are taken care of and receive quality care?
Thanks, Amber. That's a really good question. And I think the answer is it's similar to planting a tree. What's the best day to plant a tree 40 years ago? What's the second best day is today. So, you know, at Frontenac County and the Warden's Caucus, we believe in doing our homework, presenting fact-based arguments. Our home care administrators are in front of council on a regular basis, advocating on behalf of the sector. And, you know, from the administrators, the CAO, the Warden's Caucus, you know, we believe in doing our homework. So two important facts, you know, the province changed to an aging in place strategy in 2011, 2012. And since that time, the cost of paramedic services and long-term care have increased by 4.5% on the municipal side per year in Eastern Ontario. You know, if we aren't at the table, participating in the discussion, we're going to bear the brunt of the costs. We need to be at the table. We need to be strong advocates in front of our councils. We need to be strong advocates with our partners at AMO and Advantage Ontario, and make sure our voices are heard. The province is changing from a largely dark hole LIN model to an even darker hole Ontario health team model, where decisions are being made on our behalf without our input. And you know, we can't sit idly by. And I know that it's forever a discussion about municipalities aren't in the healthcare business. I don't think we can sit back and say that anymore. You know, we're in the healthcare business. The Ontario health teams are talking about the social determinants of health. Those things are going to affect our budgets, and we need to be out there advocating. And I use the analogy that I used to have a mechanic that started at the most expensive part and worked back to the $4 part. You know, we are largely the cheaper option compared to hospitals, and we need to guard that and be participating in the process. So be strong, be an advocate, start with your own council, work with regional and provincial partners to make sure that we are part of the solution and that we're advocating for our residents in our homes.
Thank you. I wondered if Kathy, Jane, or even Monica wanted to jump in on that and offer your comments based on what Kelly said.
I mean, I'll jump in for a second. The one thing I do want to add in terms of, and we did see this benefit during COVID, is just the other reason our homes did better during COVID is just because of the municipal advantage, right? We were able to mobilize, redeploy some of our regional staff to help support. We have paramedics and public health right in the municipalities, so they were able to support our homes. We also have, we're right in the community, right? So our community partners are right there. We know them well. They help support our homes, and in turn we support them because we are the face of our homes, embody our community. So I think to Kelly's point, we do have to keep advocating for this care. It truly makes a difference, and we do support other community homes across the region of Peel as one example. But I think our advantage is clear, and we continue to educate others. But I think we are the cost-effective, solution. Thanks.
Thank you, Monica.
And a couple of things, because the whole issue about healthcare being a provincial responsibility, we are legislated to, we being the municipalities, are legislated to do certain things by the province. They direct us, as is their legislative ability to do so. And as much as, and Kelly's right, we make the comment that the property tax dollar was never intended to support healthcare or social services. And Ontario is so different than any other province for what municipalities do with the tax dollar and how we stretch it. But we also, and perhaps and Michael and I have talked about this, we need to amp up our other comment, which is pay for say. We do pay over $2 billion, and you'll see this very much in our 2019 paper on the municipal role in health, is we put in over $2 billion, and that's long-term care, public health, land ambulance. Each one has a different funding formula, but there is municipal dollars in there. At the same time, what we don't have is pay for say. We are not part of the planning. We're not part of the implementation. It's given to us as opposed to us helping to co-design it and such, and what works. So we've always said it, but perhaps we just need to say it much harder. And again, we're having those conversations with health. We'll continue to do that. Long-term care really got it when they developed their community paramedicine program. And we said that community paramedicine is primary care, and that they should spend, they should pay 100% for the community paramedicine program to keep people aging in their home while on a wait list. And kudos to the Ministry of Long-Term Care. They heard us, because it is very cost efficient to have people aging at home with appropriate supports. And that's the big issue, is how do we get those appropriate supports? And that is both healthcare, but it's also mental health. And that's a big issue for us, is community mental health and programming, as well as the social services, which again, municipalities do the upstream work on the social determinants of health. And I will say that we're starting to do some interesting financial analysis about how much municipal governments contribute to social determinants of health. So stay tuned. We'll hopefully have that information in time for our conference in August, where I believe we're having a concurrent on Ontario health and municipal governments, again, that we are looking for integration, that municipal local governments need to be part of the design and execution of healthcare, and that it shouldn't just be talking about hospitals or physicians, but rather community care. One more comment before Amber puts me on mute. And just from I don't have the numbers, I was just trying to pull them. But if you look at what the cost, the health economics analysis of the cost of providing care, hospitals are at the very, very top. I think it's about $1,000 a day if you take that in per person. Then as you move down, I believe for long-term care, it's at about $200 per day per person for providing that. Whereas if you keep someone aging at home where they would prefer to be, I think it's under $50 a day, again, with the right supports. And that gets us into supportive housing, that gets us into home and community care and primary care, and looking at an expansion of models that's not institutionally driven, but rather community driven. So Kelly's raised a number of issues. These are all things that AMO is looking at on behalf of our members. But again, municipalities look horizontally as opposed to the ministry silos. And I will end at that point.
Thank you. Thank you. And all great points. And Jane, I'll send it over to you.
It's hard to follow that, but I was going to say, I concur, I echo Kelly's comments, and then Monica, you hit it out of the park. As municipalities, we are in the business of healthcare. bottom line in various components, whether it's paramedic services or long-term care or home and community care, and all those determinants of health, Monica, that you highlighted. So housing is such an important component, and it's directly connected to healthcare, income support, children's services. I mean, the list goes on and on. And to Kelly's point, we have solutions, and we have economical, efficient solutions. So when we're talking about the development of these Ontario health teams, we have to be at the table. We have to be part of that process. Municipalities, we should be part of the whole governance structure, because we have, we're such an invested stakeholder. Not to be at that table is a real disservice to, I think, our citizens. So, and Monica, when you hit on even community paramedicine, so talk about innovation, and kudos to the Minister of Long-Term Care and that ministry in the county. We just received approval for $8.1 million to expand our community paramedicine to support seniors in the community that are on the wait list for long-term care. And talk about an innovative approach. We've already had success in keeping people in their homes with chronic disease management, et cetera, through that program. So, municipalities have so much to offer because of the breadth and scope of services that we provide, that to me, it's a no-brainer almost. We need to be at the table for the evolution of our healthcare system.
And I'm going to jump in a bit more on community paramedicine, one of my other passions, because community paramedicine, even though it has no legislative basis right now, and that gets us into some really risky areas, and we are advocating for a policy legislative framework for community paramedicine, but it fills in those gaps. And the benefits are both to society as well as to, quite frankly, the Ontario government, because if community paramedicine goes in, and there's so many different programs, but if it's a wellness check, just to see how people are doing, especially seniors, that saves someone from going to an emergency department, probably by 911 paramedic transit. It also, we know that social isolation is a huge issue for our seniors at home, especially during COVID. There are so many good reasons to, again, as everybody talks about, wrap the care around the person as opposed to the person going to an institution. And I think we're just starting to see some evidence that community paramedicine can provide that if properly funded. And again, the liability takes my breath away at 3 a.m. At the same time, we'll look for a better framework for community paramedicine, because again, it's looking at it from an integrated point of view to the benefit of everyone.
Thank you. And Kathy, I didn't know if, not necessarily on community paramedicine, but from Peel's perspective, I wondered if you had comments on that. And then I do want to get in a question to Kelly on the KPMG report and stuff. So.
Yeah, I just want to say one thing, because I think everybody has said such great comments, but the other benefit we have as a municipality is just that we are used to being extremely fiscally responsible, right? We have to stand up right in front of council and count every penny. And I'll give you one example. With our butterfly program, while it was more expensive, we've demonstrated to the ministry that it is significantly cheaper than a supportive care unit. And we've had just as good outcomes for the people living with dementia. And as you know, we have a large percentage of the people in our homes with dementia. So while, we do innovative models like Jane and Kelly and others do, we're very cautious and very respectful of the taxpayer. And so I think we do an amazing job with limited funds. And yes, kudos to community paramedicine. We're enjoying it in our region as well. And we look forward to the data, right? I think that's the other thing we do really well at the municipalities is we always use data to demonstrate effectiveness. Thanks, Amber.
Thank you, Kathy. Kelly, I wanted to maybe not get into the details of I know you said that there were 6 recommendations, but maybe the approach and maybe why it was that the Warden's Caucus felt important to take on this.
Thanks, Amber. And yeah, the 6 recommendations largely follow the 48 recommendations in the AMO report, just into larger buckets. But at the Eastern Ontario Wardens Caucus, we firmly believe that our advocacy positions are better when we go to the province with data. So it was a 2-part study. The first part is, what's the current state? What's our staffing look like? What's our budget? Where are the numbers coming from? So that we'd have a good story. So for example, every single municipal home in the Eastern Ontario Wardens Caucus is under the provincial average in funding, but we are the #1 choice for people on a wait list. So 67% of people put, a municipal long-term care home first, but we're only 16% of the population. I think that speaks volumes too. So that was the first part is, what's the current state? Where are our staff? What's our numbers? What's our budget? We contribute about $30 million in local tax dollars to that number. The second part was developing the advocacy. So instead of leading with the advocacy, we start with the data. We did the same thing for paramedics. We've done the same thing for social housing. We're looking at doing the same thing for on the Ontario Health team. So starting with the data and developing the advocacy, which I think is a position that AMO is quite familiar with as well. And we find it to be very effective when we go to our councils and very effective when we go to the province of Ontario.
Thank you. So I think given that there's 15 minutes, I didn't know if any of the 3 panelists wanted to provide some sort of end of the session remarks. What we can also do is hopefully have the link sent to myself, and then Michael and I can send and submit out the links both to the report that Kelly just spoke about, but Kathy and Jane. But if you had any sort of last minute thoughts for our panel, our participants today, even hopeful messages, what would they be? Keep on keeping on, maybe. Kelly, I'll start with you. What do you think?
I just want to give a big shout out to all the frontline staff. I mean, they're the ones that have been taking this on the chin day in and day out. And what a wonderful group. I mean, they do the job. They're there every single day. Let's start with that, and then a big shout out to the families and our residents who have been through very traumatic situations and circumstances, and the average length of stay is 18 months in a long-term care home in Eastern Ontario, and we've been in lockdown for almost a year. So, that is their last home, their last rocking chair, their last cup of tea, the last chance to see their family, and they've been under very difficult circumstances. So let's start with that. I think that's really important to remember. It's all about the residents. So, thank you.
Okay, so I will ask folks to the panelists that are on here to stay on video. This will be quite short. I just wanted to make sure that folks on the line knew where to find our website resources, and then I'll pass it to Michael to wrap up. But basically, the website resources here. Oh, you guys see that? Can you see the fact that my PowerPoint isn't working? Let me just stop share there. Okay. So the website exists. I will share it with you. The joy of technology. It is brand new, and the difference here is that we've sort of done a really good job, I think, of categorizing the different services. So under Health and Human Services, which we'll share with you, you can now sort of search or filter out between different categories, things like children's services, housing, immigration. These are all files that Michael Jasek has always worked diligently on. The other thing, of course, is long-term care and seniors, but social services and public health is there. And the other filter you can start to use is things like, is it a backgrounder, if it's an external submission, if there's a report that's gone out, or a policy update. I know that Lisa had mentioned doing daily webinars. AMO's basically since the beginning of time. I don't even know when it started, but March last year, we've been doing mostly daily updates on the different closures and openings and closures, et cetera. So those are also on our website. So I'll make sure that that those are included when we send this out. But without further ado, I'll send it over to Michael and to do a few closing remarks, and we'll get you out before lunch.
Thanks, Amber. Yeah, just to wrap up the session, I hope you found this session informative today. Would like to thank Amber for organizing and moderating this session today. And I think on behalf of Amber, Monica, and I, we'd really like to thank our panelists, Kathy, Jane, Kelly, and Lisa, not only for today's session, but for providing, a wellspring of knowledge and experience with us through AMO's working group on long-term care, and somewhere a couple of different hats also sitting on our health task force as well too. So that is greatly appreciated. I was going to mention that AMO's advocacy on long-term care is ongoing. Amber and I can be reached if you would like to provide any input. I think at the close of this session, we can put up a slide with our contact information should anyone like to follow up with any questions or just general input into AMO's advocacy directions. We're always happy to hear from members, whether it be elected officials or municipal staff. So with that, unless anyone else, Amber, unless you have any other closing comments, I think we can probably wish everyone a good day. And as you mentioned, this recording and materials will be available to people following this webinar.
Absolutely. Thank you all for attending today. And as I say, the contact information will be part of the slide deck that we'll send out. But I wanted to make sure that everyone got enough time for lunch before the budget. So best of luck to everybody. And thank you so much for participating today. I really appreciate it. Take care.